A drug with a long history of abuse is now being used to treat depression. Known as Special K on the club scene, the FDA has now approved ketamine as a nasal spray.
And as news specialist Heather Simonson reports, some patients and doctors say it is a game changer.
He thinks he's a lapdog.
For a while,
You're not a lapdog.
Bracken Funk thought he was out of options.
Can you be my good boy?
Rocky isn't just a pet, but a trained service dog who helps him through PTSD episodes.
I can honestly say he saved my life.
With the help of Rocky and what he says is a very helpful drug,
I've tried everything under the sun.
Bracken is finding relief from depression and anxiety.
No one should have to feel like that.
He's had 8 treatments of Spravato, a brand name for esketamine, the newly FDA-approved nasal spray for depression. It doesn't replace antidepressants, but mental health professionals say it's good at suppressing suicidal thoughts.
It's kind of a sister molecule of ketamine.
Ketamine has been used as a general anesthetic since the 1970s. It's also known on the club scene as Special K. Dr. Reed Robison says esketamine, the nasal spray, is a cleaned-up version of ketamine that minimizes side effects.
We're embracing it wholeheartedly.
So far, it's helping Bracken.
To be able to flip the lens and see a different view, and it's not all black, and there's hope and power to that hope, it's unlike anything else I've tried.
A typical course of treatment involves twice a week for the first month, once a week for the second month.
Dr. Robison says it creates neuroplasticity in the brain or new connections. A 2018 study published in the Journal of the American Medical Association found significant improvement in depressive symptoms in adults using the nasal spray. That's good news for Connie Harton.
It's been an ongoing battle for me for as long as I can remember. The depression continues to hang on and has a chokehold on me.
Ketamine injections worked for her. Doctors have been trying it as a treatment for depression for years. But since injections aren't officially approved for mental health conditions, they're not covered by health insurance.
I basically felt like I could see the old me coming back.
Spravato, the nasal spray, is. While Connie says it has fewer side effects, for her, it hasn't been as helpful as the injections.
Is the Spravato as effective?
For me, I would say no, if I'm going to be really honest.
Dr. Robison says neither the nasal spray or injections are long-term treatments.
So you try to wean off once they're in a better place.
Yeah, for some it's enough to pull them out of an episode of depression.
I know what it's like to feel hopeless and helpless.
Connie's struggle has lasted 25 years. It's been tough for Bracken, too.
Just try to keep putting one foot in front of the other.
But now they have what they lacked before, hope. Heather Simonson, KSL 5 News.
Heather, thank you. As these treatments become more popular, make sure you choose a reputable clinic. Ketamine should be given in close collaboration with mental health professionals.